Hi everyone, we're here for the podcast Santopia in Wild Salsa in downtown Dallas. We wanted to shake it up, make it different for this podcast today. We are in the middle, or we're at the end of Dallas Startup Week, and we're enjoying the energy here, all the inspiration of all the entrepreneurs. I actually just came from the conference for Hint Water. I'm drinking it here. I'm showing it here. Ooh, pretty. The founder was an inspirational woman and really concerned about trying to change products and taking out dangerous products that are in water, and empower the buyer to know that that's going on. Even though you don't know. Yeah. And so I feel like this is the same message that we're trying to do on Santopia, where we're trying to empower you guys to take ownership, have some resources, learn something new, and then possibly go and get help or medical advice and actual clinical care from a doctor. So we're doctors. I'm a doctor. She's a licensed professional counselor, but this is a health education show, so we're here to give you all the resources that we know and the inside scoop. And so we wanted to start off with trying to introduce my wonderful woman colleague here, Miss Keren Acuna, and to see her journey and to see what she overcame first, to probably hopefully inspire some of you out there who are probably struggling, or how do you go about doing that? Yeah. And she's been there, done that, so I think she's a good person to kind of tell us what she did. Welcome to the show.
Thank you. So I'm really excited to be here and part of Santopia, and to everyone that's tuning in, and the whole community. If you're going to tune in later, I'm really excited to be part of this. And so, like she said, my name is Keren Acuna. I'm a licensed professional counselor, and I'm a registered play therapist. And a lot of my training has been done in the field of trauma.
Yep.
So I've got some EMDR training. I'm in the process to go through that certification process. Okay. And then I am trauma-focused CBT trained and Circle of Security parenting. So a couple of things here and there, additional to the licensed professional counseling from Texas. Yeah. That includes. And so a little bit about me, just to give you guys a background. I grew up in Los Angeles, LA. Yes. Crazy side of LA, and then we grew up around that area, couple different places. My parents are pastors, and so that's where I grew up. And so after that, when I was around 15 years old, I was a junior. I was 16 at junior. My parents decided that they wanted to just pick up and move to Texas, and so we ended up coming to Texas when I was about 16. A big transition there, because when you're in your junior year, that's pretty hard. But so then I went to Evangel University in Springfield, Missouri, and started my bachelor's program there, and then went on over to Southwestern AG University in Waxahachie, and I did my bachelor's in counseling, and I did my master's in clinical counseling psychology.
Cool.
So that's where...
Now you guys know why I brought this woman on the show. I mean... Who hasn't experienced trauma in their lives? If you haven't, I think you're not human.
As a student, you experienced trauma.
Every final exam.
It's hard, and that's not to minimize trauma. That's not what, Yeah. But it's a difficult, definitely a big challenge.
Right.
So.
And two, I feel like the reason why I wanted to bring you on the show is because people associate trauma like, oh, only the big hitters, or I never experienced anything, and it's like, well, that's what we're trying to say, that trauma can be different ways, and it can happen acutely. It doesn't necessarily have to affect your life forever, but the thing is that sometimes trauma can, if you do not address it well, affect your life forever. Absolutely. And you don't have to experience trauma in your childhood only. You can experience it even as an adult.
At any point in our lives, we are all subject. I mean, not subject, but we are all in a position to experience it.
Right.
As human beings, to experience some form of trauma.
Right.
So I guess to start off with trauma. So
what is it?
Exactly, what is it? So that you don't leave here feeling traumatized, like I'm confused. Trauma is a state where you feel confused, or a situation happens where the person feels there was some form of threat physically, or confusion emotionally, and shock. And so that comes in various forms. And so Many times when we think of trauma, we think of something extremely severe, which it is. I mean, we look at wars, a lot of things that are happening overseas. It could be anywhere that someone's experiencing violence in their neighborhood, their community. A sense of safety is shook up, and that could be a trauma. And so there's also people that have experienced hurricanes, natural disasters. That could be a trauma, a death in the family, abuse, domestic violence. PTSD we see a lot with, all through this spectrum, but we have this belief that PTSD, and that's post-traumatic stress disorder, we think that's only associated with war veterans, which it is.
But is the classic example, but actually...
it's not just war veterans, but a lot of people that have something that has happened in their childhood, that's happened in their lives, that has affected them, and it's just created, again, it's shook up their sense of safety. It could even be a situation where someone went to the hospital and had
a loved one
surgery.
Like, you're not even the one sick, but you can experience trauma from being a part of something traumatic or for someone else that you care about.
Yeah, and the other thing to say with that, which I think is really important to note, is that working with children and adults that have been abused, that have had trauma, that's one of the things I work with. But sometimes we see that the child that went through abuse or went through a trauma, but a situation that was traumatic, they don't experience trauma, and it's their parents that are experiencing the trauma. So not everyone that has gone through a difficult situation that could be...
can experience...
Yeah, so some people
the trauma, the quote-unquote definition of what trauma is that requires therapy.
Yes, and so that is to say that not everybody experiences a trauma when they go through a difficult situation.
Okay.
But we can all definitely be vulnerable to it. So we have to be mindful of it. We have to know what it is, what mental health is, and we can look into some symptoms right now. But that's just a little bit of a definition of what trauma is. Yes.
And that's very good. That's why, I wanted to talk about it, because I think no one can, everyone can relate to this topic.
Absolutely.
And and the point of Santopia is a health education show that you're going to know, I learned something different about that. And then, I have a guidance of how I can go and Google that or research it my own, going back to the empowerment of you to become educated about something, get some coping skills.
Absolutely.
And then if you realize, this is not enough, maybe, and then have some resources at the end to know where to go.
Yes.
If you need a little bit more than just reading up on the subject.
Yeah, and that's a great thing you bring up, because what we're getting at here is educating, and so it's not to give any kind of advice. It is simply to educate all of our viewers, or all of your viewers in Santopia podcast, that there are resources out there, and we will get towards that at the end. But there is resource out there. There is help. It's really important.
Well, Keren, so the next question would be, since you practice with this, you see it every day in and day out, what are a major theme of the type of traumas that people you've seen, and what kind of, through your, obviously you have experience and expertise, what have you seen? It might be insightful for someone to know about trauma, and then how common it is, or a little nuance of your, distilling it, and then you're I think that this could be an overarching theme or advice in general about trauma.
Well, I work a lot with children and families that have been impacted by trauma. And I'm a bilingual therapist, so I do see a lot of Spanish-speaking families. And that is either the child speaks English, and then the parents only speak Spanish, and so that's where I come in. But one of the things is, especially within the Hispanic community, is that it's very much seen as taboo, or it doesn't really exist, or you need to snap out of it and just keep going. And so it's not looked on as we would the health of the body, and the mind is connected to the body. And so that's one of the things that I would say that I see, is that we have to we get people that come in with symptoms, and many times I first of all, I don't understand the symptoms. I don't know what's going on, and that's why it's so important to get educated. And if there's something that's a little abnormal, something that's that you're noticing has changed and it is affecting your daily life, then those are
that's
things
the key.
That is the key, because we all get sad.
Yeah, it's not like, oh, I feel sad, I need to go to therapist immediately.
Yes,
no, it's not
right.
that.
And that's not the chaos we're trying to, invoke in people. But it is very much that we all get sad, we all experience anger, we all experience sadness.
Right.
But it is something that
dysfunction of a daily activity.
Right, it's disrupting your everyday life, it's affecting your relationships, it's affecting your work performance. So if it's something that's getting in the way of that and disrupting that, then that's something that you would want to get looked at and seek help. And so going back to your question, working within a lot of the Hispanic population is educating the community, educating my parents, educating my teens, my kids in really understanding what trauma is. And that, again, it's an illness that is in the body.
Just like diabetes. Just like diabetes. You need to get your metformin, you got to get insulin, does the same thing.
Exactly, but yet we wouldn't shame anyone because they had their heart wasn't working properly. That's, part of it. But, so it's the same way that sometimes we feel this stigma of, I don't want to go get help because I have some symptoms of depression, I need to snap out of it. And so some people can do that and they can work through it, and some people can't, and they need
a coping skill.
Because
I think that it distills down to, it's not that you don't know how to get coping skills, is that sometimes someone needs it's like a coach. That you might know what basketball is, and you know about a layup, you know about how to dribble, but maybe you're not dribbling effectively enough to get the layups or whatever. Yeah. And then that's the coach. That's when you come in, Keren, and you're kind of guiding them in the journey for them to discover their own way of coping. Absolutely. And you're not trying to tell them or dictate which coping skill they need. You're just presenting an array and maybe testing it out along the journey with them.
Which I'm glad you bring it up, because many times people get scared to come to therapy because they're like, I'm just going to go and talk to a stranger, which it is intimidating. You're not naturally going to we sit with a stranger and say,
"Here, spill all your beans out."
Right, but
all your life.
Exactly. It's very unnatural, but we all have a need and a sense to connect. Like we said before, we have a natural desire to connect. And so when you go to therapy, know that it is talking, but it is a structured treatment. That is there to help you. Like, Dr. Irving just said, it's coping skills, it's processing through what happened. So not to get too much into the therapy process, but it is great for you just to go into one session and get information from from a therapist that you would go see, so you can get informed as to what it all includes, because therapy is proven to be very effective in the treatment of trauma and depression and for just mental health.
So you mentioned like that one arching theme that you're seeing, and you gave me an answer. So you said it's a lot of taboo, and I would assume I would like to add that you might know a lot about the Hispanic because that's what your experience, but I feel like it's taboo for anyone, even the American or African American. In general. And then you said like a solution for it is that when they come into the door, you educate and say and then they're like, oh, okay, I understand.
Yes, I'm so glad you said that.
So I was gonna,
because I don't just work with the Hispanic population. I work through all cross-cultural, and so. But yes, I think generally you just hit the nail on the head that it is just a stigma in general, and so education is power. I know that you hear that a lot, but it's like it is power when you understand what is the root of why I'm feeling the way that I'm feeling, and to actually get some help through that and some support through that. It's very empowering, and that's why it has been, like I said, it goes back to this is treatment, evidence-based treatment that helps people overcome difficulties in their lives where it affects their ability to cope with it. So yes.
Cool. Yeah. So I guess outside of just educating and probably doing this show to help someone kind of demystify the barrier of like, I don't want to go because that's taboo. What other tips or how you've seen? Give me an example of one personal experience story where they were super scared, like you were almost kind of worried for the person, but they're not on board on getting therapy. And how did you convince them to come to the side of okay?
Well, I think
what I'm saying.
Yeah, no.
How do you convince one of those like, I don't want to come here, I don't want to be here, and then what you do like to get them?
I think it's important. I'll say it generally because it's happened several times where you do get the someone that comes in and is very skeptical about counseling, especially working with children. Like the parent, the child is involved and the parent isn't very committed to it, and then you get the parent that's committed to it and the child that isn't committed to it. So the way that I approach that is simply, I think going to school, being a therapist, we can easily say, look, I've got all this training, I've got all this, specialized training and degrees that I can help you. I don't think that's what makes people feel comfortable. I think it's being vulnerable and being open. And so one thing I do is I educate them, but say, why don't you just give me 3 sessions and give me the opportunity to see how I can help. And if in those 3 sessions you're not on board, then we're done. We're good. You can decide not to do that, because it's just letting them know that I'm not here to tell you this is what you have. I mean, counseling isn't someone to tell you what to do. It's someone that's helping you through that process, like you said, a coach. But it's treatment, like you would go somewhere and steps that you do follow to try to help you get better. But I think a lot of people get scared. I mean, just going into a counseling office can be intimidating. So when a therapist sits with you and says, you know what, let's just try this. And if you don't, because one point to think is you may go to a therapist and you may not work well together. It's just
a
life.
Personality thing. And I think this is the one type of therapy or medicine that would be like, it depends on, it's like a relationship, a bond that you build. It's a professional relationship. Because
boundaries.
Yeah, there's a boundary, but almost you can become almost like personalized so much because you're being very vulnerable. So there's a high connection.
Yes.
But that's the thing you want, because in that you'll be able to reach your solution better. Yes. If you're not trusting that person, it has nothing to do with that person. Sometimes I just don't like her personality. I don't like her ways to. Okay. Yeah. I think that's good, and then go and find someone else.
That's a great point, because
it's an important element of the dynamic.
Exactly. You have to connect with your counselor. I mean, it's okay to shop around, to go to a therapist and say, on my intake, I don't know if this was for me. Being honest, I know that as a therapist, if it doesn't work out, I invite openness, because maybe I can match that person with someone, and I have matched a client with someone else that they would connect better with and they would work better with, because different therapists have different modalities and different styles of treatment. So it's okay if you go to therapy and it didn't work out. It doesn't mean that's how all therapists works, and that's just a general thing across the board. So being open to that and kind of looking around.
Yeah,
that's what I would.
That's
encourage.
good. I mean, I don't want, and I know it's kind of like, well, I don't want to. It feels like I don't want to do that person wrong. But it's like, actually, this is actually something natural, and almost probably you're already expecting that. You're kind of almost giving that freedom to the person, because it's kind of a personal decision. And
absolutely, and your therapist is there to work. I mean, wants the best for you ultimately, and if that's not with them, they want that with someone else, because that's what we came into this profession. So it's for you
good
to help. Yes.
Well, let's transition into probably like actual common big hitters. Like, I know that depression is a big one.
Yeah.
And there's a lot of like subclinical depression. So it almost like, it's like a very, it's a wide spectrum of depression.
It is.
It's very common. And what are the differences between you're just sad versus this is a problem.
Yeah, and
so the people are aware that, like, okay, who's listening, you're like, I feel sad, I feel this. What is? I don't even know. Processing.
And we've all used it in a way, like when we said earlier, with the school traumatized. I mean, sometimes people do feel traumatized through the whole process of school because it's so draining. But sometimes we use depression very incorrectly. Like we say, I'm depressed, and we just feel sad.
Like a trending word.
Like a trending word, and it's really not. But
so how do we not make it like that? What would be like?
Right. One thing I would definitely encourage is looking at behavior that is abnormal. That is not something. So if we are all in a state of sadness, especially after an adjustment, there's been a new job, a new city, those are all very typical or very normal responses. Sadness is a normal response, even depression, to a change. Yeah. But it's when it's taking, I would say, longer than 2 weeks to a month, like you've noticed it's been ongoing, and it's affecting your daily life. Again, every single day I feel so drained to get out of bed. Every single day I'm just struggling, and I mean, it's not getting better, and it's just progressively getting worse, or even even if it's maintaining the same, but you're not feeling any sense of joy over this period of time, it's something that I would say get it checked out. I mean, there's medicine, and I know that there's people that have their reservations on that, and that's why
therapy is a good alternative.
Absolutely, and
if you want to, you don't want to put with drugs and all. Mm-hmm. And it's like one of the most prescribed. I just read something somewhere. I don't remember what article it was, but like SSRIs are like almost like number 1, 2 biggest prescribed medicine, and it's in the water that we drink. Like they find it in the water.
Yeah.
So it's like candy, apparently.
It is. But it's important to note that, I mean, when we go into a chemical imbalance,
sometimes you need
brain,
it. We're not saying right, but there's gradations, and so there's a professional that needs to be in that place to kind of make that call for you.
Yes, and so an example would be if someone comes in to therapy and there's a chemical imbalance and they're doing all of the work, and we've been working on different treatments and goals, and things are not getting better, then a therapist, or an example would be I would recommend going to a doctor, a psychiatrist. A lot of people get scared when they say psychiatrist, but a psychiatrist is one that I would recommend. I know
a general PCP can do it.
Yeah, a general PCP can do it.
But like if you're needing want an expert to be on your case
on that thing,
and if you're complex, like if you have so many other drugs already, like for chronic things, it might be better to go to the specialist for that.
Yeah, you want to go to the specialist. I mean, and it's nothing wrong to go to your primary care physician as well. That's what I'm saying. I have a lot of clients that I work with are with their primary care physicians, but so again, I'm going back to there's someone that has a chemical imbalance and is doing all the work may feel like, what, I'm doing everything and I'm not getting better, and that's where we may connect with the doctor, and then we start seeing improvement. Where we also go the other way, where someone's taking medication but they never get treatment and they never work on the trauma or the event that happened,
the
and
coping skills.
So
they're vulnerable to have it again, and then it compounds the abnormal behavior or coping abnormal or not good coping skill that you're probably doing on your own.
Yes, and that's where I get clients that come in and say, I don't want medicine, and so we say, all right, let's see what we can do and get started with. Not necessarily going that route. Let's try. I mean, I completely respect people that have those reservations. I also want to take away the myths, or the I guess myths out there that antidepressants are going to be like you're going to get addicted to them. They're not habit-forming medicine.
Oh no. So you've had that? Like people worried about that? Say, no, guys.
Yes, they get worried about if I start taking antidepressants, then that means I have to take them for the rest of my life. That's not true.
Right.
It may be, but again, it's not the sale. And
right. And it's a doctor's going to be telling you that, and you're going to be working
with a doctor
to wean you off, and it's a decision on both of y'all's part.
Yeah. So they're not habit forming. Antidepressants are not habit forming. So it's really important that you guys
that's a good point.
Know that part. Yes.
Cool. So you talked about PTSD earlier, and I think it's a very alphabetical soup term, that PTSD, and it sounds complex. And so, can you explain like what makes something because that's a very complex one. Because like you said, everyone just goes to like war or trauma for veterans. So just kind of give us like, again, the same kind of thing for the depression, where like what would make this qualify as PTSD versus not, like the Bader thing, and then how it can be seen in a different way. Like give an example.
Well, I will talk about some of the symptoms, because I don't want anybody here to think that I'm diagnosing them with anything, because that's not what I'm doing.
Just saying that you can Google this too, but we're just saying that, so.
You got cut out for a second. So a lot of the symptoms that war veterans, people that have gone through abuse, assault, again, natural disasters, it's where there's this inability to concentrate, hypervigilance. And when I say hypervigilance, it's constantly being in this survival mode of what we call fight, flight, or freeze. And so there's always this
like hyper-awareness
of all of your surroundings, difficulty sleeping, mood, increased anger, irritability. And so again, it's something that you have intrusive thoughts of what happened. So it's like you can't stop thinking of the situation that happened or the nightmares are coming in. So it's something that is really important to note. If those are things that are happening, that could be treated. I mean, there's a lot of treatment out there, and so it's important for you to be aware of what's going on. And going back really quickly to children, which I think is really important, is parents are the experts on their children. And so when they bring them in, I'm not there as a therapist, or child therapists aren't there to say this, and this. They need your help. And so we need your help in working and collaborating and saying, what are some symptoms? And when I say symptoms, what is behavior? What are the emotions that are happening in your child's life that is different from what you're normally seeing?
Yeah.
And so those are things that are going to help you see if my child has experienced that, if they went through a significant change in their life. And that can also include divorce. I mean, separation.
Like the kid experience thinking, oh, they don't know what's going on. They'll just know that mommy and daddy are not together, and that'll be the end of it. And kids pick up a lot of stuff that you don't think they do.
Or they let it out in ways that are not the easiest and the most lovable. I'm sure you've seen a lot of quotes out there, because the way that they process those feelings without therapy is many times in anger and in tantrums and behavioral issues, and look at the grades in school and how that's affecting them. And the other side of that is perfectionism. I'm just going to do everything right and perfect and not mess up, because
I can't be another problem for my mom or my dad.
Yeah. So as parents, it's important for parents to be mindful of what are some changes I'm seeing, and maybe it's a good idea to get it checked out. Not because they had, a tantrum at the store, especially if they're 3.
Yeah, or they wake up in the night, I had a nightmare. No, we're not talking, that's not PTSD. Yeah, that's just not. Every child, normal child. But you're saying that it's like a
cluster of symptoms.
Symptoms, and that it's consistent for how much time?
A period of time. I wouldn't want to give. I just think if it's a
persistent and long term,
and it's affecting your everyday life, that's something to seek.
Running theme, guys.
Yeah. So it's something to look at and talk to someone, because it could be some. I mean, one thing to really consider when you're talking about depression, how you said it's so broad and general, because there's so many things that can fall into that, is also there's so many factors that can play a part in that. And that's, again, a traumatic experience, but it could also be other medicines you're taking can cause a sense of depression. So environment, like we said, changes. It's really important to know that it's not just one thing.
Weather too.
I'm depressed, I had a trauma. So many different things, seasonal.
People in the north, like where kids, like they go to college and they, and they're stuck in the campus.
Yeah, so it's important to know that it's not just because of trauma that you would get that.
Yeah.
You could feel like you've never had a situation that was significantly distraught for you, but you could experience depression, and it could be genetics. It could be something your grandmother had, and then something you're
at a higher risk for. Yeah, depending on the environmental stressor.
Yes, it could be triggered that way. Yeah.
So, to kind of wrap up, I would say this has been very insightful, and I hope this helps someone. And then I also think that a good question to come up next would be, okay, this is kind of like if someone was listening, they'd be like, oh, I now know some things about myself, but I think, how can someone who sees a loved one, like, what can they do? Because sometimes some of these symptoms, the person doesn't realize in themselves that so it's actually someone picking it up. And then, so what happens if you're in that situation? What does that person do?
Well, I really love, if you ever get a chance, I think Brene Brown is really popular.
Yes,
right now,
I love her. I love her.
She's got such good things. And so many times we want to help, and we end up not helping. And so one of the things that I would just say is listen, and just provide support by actively listening, and not saying things like, at least you have this, or at least, because sometimes we try to fix everything and try to make that person feel better. When that
don't be fixing stuff that you can't. You didn't go to school for that. Don't do that.
But you want to be a good source of support for your friend, and that it comes through listening and referring them to someone. If you say, here's some information. Never push someone that they need to go to counseling. That is something they have to decide for themselves. Yep. And that goes the same thing. I know that's a little different with parents, because they're underage and you're bringing them to counseling. But with parents, one thing that I would say is having the patience, because one of the things that studies have shown us is that parents are key in helping a child heal. And so they are just key in being a support to their children, being part of the therapeutic process, that is a key element in helping a child process grief, process trauma, process depression, process different things. And so, again, going back to that support question, there's nothing wrong with offering some information and saying if you ever need it, but never pushing someone and saying you need to go get help. And this is giving that information for them to decide for themselves.
So, perfect segue to the next question is, so what are some of those like tangible like resource places where people can go?
Well, if we're in the Dallas area, so
Yeah.
I know I'm coming from East Texas. I did start my career here, so I know a couple of different organizations. The one of the organizations that I feel would be a really good resource for you to call, especially in trauma, is the Trauma Support Services of North Texas.
Okay.
That's TSSNT. And you can call, and if they can refer you to someone. There's also the Dallas Area Rape Crisis Center that's here in Dallas. There's several private therapists. I mean, Dallas has a lot of places for you to get resources. Googling, but I would really recommend to contact Trauma Support Services of North Texas and just call and say, where can I get some counseling? Maybe my insurance covers it. Maybe I need self-pay. Maybe there's some scholarships available for me to get some free assistance or grants. So the key is knowledge, and so getting that information and seeking it and finding what are some resources, because a lot of people don't go because of the afraid to look, or they just don't know.
And just to kind of augment that, you said like, we're in Dallas area, there's like so many, so just pick and choose, like there's so many options. But just in case you're like in El Paso, like where I was practicing, there is some, but then there's not like that specialized where you would find it here, you would find that specialist here. But what happens if you're in Tyler like you are, or if you're in El Paso? I would say that there's actually people, and I think it's a trend going into the therapy world and also in medicine, where it's called telemedicine. Like people can act like it's a little, insurances they're trying to open up the culture to be able to accept that, and not every licensed professional counselor or psychologist or people would agree to a partnership where you're an basically a telemedicine client, where you might be in El Paso, but your therapist, whatever, is in Dallas, and you have your regular sessions over the phone. And
to add
that's an option.
It is an option.
If you're not able to, like, obviously drive from, somewhere far to get to, but the resource is there, and probably if they're very specialized or it's something that you really need, that person can probably guide you to someone who does do it.
Yeah, and I would also recommend to make sure whoever you are talking to, that you're checking their credentials, you're checking their experience, so that you don't feel like
a license. They have a license,
not to practice therapy, whatever state or city that may be. But another source for that, adding to that, is Psychology Today. Psychology Today lets you add specialty. I'm looking at specialists in my area on children, on PTSD, on trauma.
It's like the Google of finding a provider in your area.
If it's Spanish, a good one. If it's a different language, it's a great resource for you if you're not in the Dallas area and you can contact them.
Yes, that's correct. Well, this has been wonderful.
It has been. I feel like there's so much information,
but I think so I hope this helps someone. And given all this trending, people wanting to do lifestyle wellness and mental health, and that in Texas actually is one of the worst states, for mental health. Like, we don't, and everyone knows it. So it's not like I'm giving a negative thing. I love Texas. Actually, I'm a purebred Texan girl.
California too.
But like that, this is a issue. And then there's a big problem with, like, this is why I'm doing the show as well, that you go on Instagram, you go on Facebook, I am a wellness coach, I'm a this and I'm a that, and come to my course, and I want you to take a second, like, pause and be like, wait, do they have a license? What is it?
And then there's some of them could be great for empowering and motivation, but again, knowing that that's very different than a licensed counselor that provides treatment.
Exactly. And so, I mean, just being a practitioner on the social media thing, I've seen that a lot. And so I want to guide you, navigate you through, and what the things that you should be looking for, and a good, reliable source where you can't go wrong here. So. Well, I hope you enjoyed the show, and we'll see you next time.
Thank you so much for letting me be part of this.
Of course.
Yes, I'm excited.
Bye.